Welcome, my friends, to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet. I am Bob, and I'm exactly one half of the Bob and Brad team. Today is truly an honor to be joined once again by Dr. Hamid Abbasi, neurosurgeon. Means he's smart, and we've had him on before to talk about a minimally invasive surgery he does for the lumbar spine. But this one is a minimally invasive surgery for the sacroiliac joint. And you're going to find out that, maybe your back pain is coming from your sacroiliac. We'll discuss all that today, along with what the procedure is, where it's at, how to get it. And it'll be worth your time to watch and listen to the show. Welcome to the show, Dr. Abbasi. Thank you so much again for joining us, and we're going to talk about a new topic today. We're going to jump right in. We're talking about sacroiliac joint dysfunction. But before we do that, because you are going to be new to a lot of people, I'd like to have you give a little bit of backstory about, so we know who you are and what you do.
First of all, thank you very much, Bob, for having me on your show again. And it's always a pleasure. And I'm a neurosurgeon, board certified neurosurgeon. I trained in medicine in 3 continents, in Asia, in my birth country, Iran, in Germany, where I did an MD PhD in University of Heidelberg, which, by the way, is the second oldest university in Europe.
Really?
Then I did research in Stanford University in California for 2 years in 2000. Then I went to Dartmouth, did 1 year of general surgery. Then I went another 8 years, did residency in Galveston, Texas. Have beautiful weather there. I just came back teaching somebody exactly my technique. Before I came to the Upper Midwest in South Dakota, and now in Minneapolis, I've been practicing for about 14 years. And I'm a specialized minimal invasive spine surgeon that as well include the treatment of the sacroiliac joint, because sacroiliac joint is practically the next joint to the spine.
And you're at 2 locations up at the Twin Cities in Minnesota?
Well, we are actually in Minnesota. We are in Crookston, in Alexandria, and in Twin City. But I just came back from El Paso, Texas, and next month I'm going to California, and I have been in Colorado. We have affiliates and partners practically in the entire United States, and we are trying to provide this kind of minimal invasive kind of care to all the population in the United States.
Yes, you do that through your ATU. I want to pronounce it right, Abbasina.
Yes.
Yeah.
Avicenna Technical University. See, what I figured out is that what I'm doing, it's not something that people can go to a weekend course and learn. And unfortunately, sometimes that's what it is. Like, we get really good at what we are doing as a neurosurgeon, as a spine surgeon.
Yes.
Like, you get very comfortable driving your car. But then you get in a new car. Yes, you have to get used to it, but you just get a little instruction, and then somebody shows you where the buttons are, and then you drive just fine. But what we do is so different. It's like getting from driving a car to flying an airplane.
Wow.
So it's something that you need significant additional training. And that additional training, because all of this is new, is not being provided by the universities, except we are making our own university to teach these highly technical skills to surgeons that want to take time to learn that. By the way, talking about Avicenna, I took the name from a polymath, Persian polymath, who in 10th century practically discovered alcohol, created significant new treatment, modern treatment that was in Europe now 700 years later in the Renaissance, and practically came with the idea of experiment, observation, scientific methods. And by the way, his book, the Canon of Medicine, was being taught until 1800 in all the universities in Europe. His name is Avicenna, and in the local call him Ibn Sina, and he lived about 1,000 years ago. And in his honor, we called our university Avicenna Technical University.
Well, I think that's terrific, and I'm sure you're really spreading out the basic intention of this man. I think to try to spread learning. So, and I think that's really cool. I mean, here's a surgeon who you got to be in the top 1% as far as being busy, and you're taking time to go to another facility and teach people. I mean, really amazing. So, do you also teach the SI joint surgery?
Yes, absolutely. As a matter of fact, I just did that. I just came from El Paso, Texas, where for the first time in the history of the city, they did a spinal fusion, the technique we talked about last time, in a surgery center on a day surgery. We did a bunch of patients. Now, all of them went home within hours. This is unheard of in the history, and especially for their city. This is the first. They have achieved that. But as well, I did a teaching for the sacroiliac joint. And the reason for that is that the problems of the spine and the sacroiliac joint goes hand in hand. Sacroiliac joint is practically an extension of our spine, of our lumbar spine.
Sure. You have a spine by you? Otherwise, I have one near me.
I'm a spine surgeon. I always have spine here with me. And I have as well lots of pictures. You have a full, I can get a full spine, but I have as well a small spine. Maybe I should go and get a full spine.
No, that's fine. That's fine. We can borrow people's imagination. So
yes. Practically, our lumbar spine is made of bone and discs interspersed. Each bone and disc are practically go to the next level, and we call them in the lumbar spine. We call them top to bottom 1, 2, 3, 4, and 5. So we have practically 5 lumbar vertebrae.
And lumbar is low back.
Yeah, lumbar is the low back.
Okay.
And very interesting trivia. We are going from 5 lumbar vertebrae to 6 lumbar vertebrae. When I was a med student, it was only 2% of the people had the 6 lumbar vertebrae. Now there are about 10% of the people have.
Really? Yeah, I have a friend that has the 6. So.
Yeah. The reason for that is that the women love taller men. People with 6 lumbar vertebrae are statistically more likely have a 6 lumbar vertebrae.
Sure.
That's why they are taller. So the women are making us to go from 5 lumbar to 6 lumbar. In 100 years, all men will have 6 lumbar.
There we go. Maybe 7. So
yeah. But then on the bottom of our vertebrae, we have this chunk of bone. It's called sacrum. Practically, when we are baby in the belly of our mother, there are 5 or 6 bone here. They grow, become one bone. We call that sacrum. And this bone is what practically hanging in our pelvis from our iliac bone or pelvis. And hence we call the connection between them, we call them sacroiliac joint or SI joint, where our entire weight is literally hanging from our pelvis. It is not a real joint, Bob. And the way we know it's not a real joint is we have done tremendous amount of research long before I was even born. We know all the muscles in this area. We know that not a single muscle is acting to move this joint.
Gotcha.
In medicine, we have a name for that. When something looks like a joint but doesn't have a motion and we know that it eventually grows together, we call that synostosis.
Gotcha.
This is in reality a synostosis, meaning it's a place that 2 bones come together, but there is no physiologic motion there. And there is practically no muscle that acts on this joint to make it move. The only time in reality this joint, sacroiliac joint, moves is when a woman is giving birth, practically our pelvis goes around it. It opens up the pelvis about 5 to 7 degrees to open up the opening of the pelvis so baby have more space to pass through. And even then, it's actually our body's amazing, Bob. Enzymes, our body produces enzymes that makes those bands. There are strong bands around it. And if you like, I have actually picture. I can show you those pictures. We have very strong bands that hold this together because we are suspending practically our entire torso, arms, and heads from this joint. But when a pregnant woman is about to give birth, there are some enzymes, they go and loosen those bands so this joint can move and open up for a baby safely to pass through.
And I assume they tighten back up in most cases.
Well, that is one of the problems is that after a woman giving birth to a baby, in the next year or two, the rate of them having sacroiliac problem is 7 times higher than general population for same reason. Because we know that once these joints become loose, motion becomes more, and the trauma is more likely to happen in this. And those bands, those tensions bands, those capsule that covers this joint are very pain sensitive. And people talk about truly very bad pain, especially many of my patients, they tell me they have that pain when they turn from side to side in the night. It wakes them up. Or another thing, they tell me that, especially when they go stairs up or down, that is when we put pressure on this joint. And again, coming back to that, this is not a real joint. And if it moves, those bands, those sensitive bands, they tell us this is overstress, and that's what the pain is, to make us to avoid many things that are going to be harmful to us, in this case, to the sacroiliac joint.
Are there other signs of the sacroiliac disease?
Yes. And, practically any sign of any joint that is gone bad can be as well a sign for sacroiliac joint. Even though it's not a true joint, in some regard, it does behave like a real joint. Now imagine if you have a problem in the elbow, any kind of motion in the elbow can cause the problem, and the joint can swell up, joint can get inflamed. If you have a joint problem like in your knees, sometimes the nerve that passes next to your knee get irritated, inflamed, and then you have pain actually coming along that nerve all the way down to your foot. And I can actually send you some picture, and you can use them, or I can show you, and I can show you a picture of the nerves that are next to this joint.
Sure.
Those are the lower lumbar nerve. We call them L4, L5, S1, and S2 nerve. So for a long time, we truly didn't understand why somebody with a sacroiliac joint, why do they have pain going down their legs? But now we understand that very well. The joint that go next to this, the nerve that go next to the sacroiliac joint can get inflamed if sacroiliac joint itself is inflamed. So many times these people, they say they have pain going down the leg even, all the way down to their foot, because L5 and S1 nerve would go all the way down to our foot, and they pass over the sacroiliac joint to get to those nerves.
So obviously, people are going to think it's sciatica.
Yes, it can pretend, it can literally, some of us, we call sacroiliac joint a chameleon, because it can pretend to be a sciatica. It can pretend to be the lumbar spine problem. It can pretend to be a problem of the hip. And sometimes it can even pretend to be a problem of the foot, because it gives you literally pain in your foot. That's why we call it the chameleon. But as well, we have another name for this joint, Bob. Can you guess what else we call this joint?
I'm not sure. What else?
We call it magic joint.
Magic joint.
We call it a magic joint because people who have been in pain for 15 years, who have all the symptoms that not local, but all over the body because of the problem of this joint. We do a half-an-hour procedure for them, and they come back and they want to stand up and hug us and give us a big hug, and are so thankful because for them, it's magic.
Yeah.
For them, it's magic. You do this, once you understand how this works, once you put them through proper diagnostic, you do a half-an-hour procedure, in 4 weeks, their life changes. And people who have been addicted to drug because everybody look at their spine and they didn't see any problem in the spine, for God's sake, because the problem never was the spine.
Sure.
Then you fix them, you diagnose them, you fix them, and that for them is a magical moment.
Well, we'll talk about that, how you'd go about diagnosing this. But how often are you seeing this in the patients who have back pain and may be caused by an SI problem, but also patients who have had fusion surgery?
Yes.
Back fusion surgery.
So no, the diagnostic of that and the data on that is very clear. We know by now that about 22% of the time, if somebody comes to any doctor and says they have back problem, 22% of the time, it is not their spine. It is back. It is lower back pain. But the source of the pain is not spine. It is actually sacroiliac joint. It becomes tremendously more interesting if they had a previous fusion in the lumbar spine. Statistically, 43%, Bob, it's almost half of them. If they come back and they have pain, it is not the spine anymore. It's a sacroiliac joint. And in a typical fashion, people who are not trained to treat sacroiliac joint, they look only at the spine. That I constantly get patients, they go to their surgeon and the surgeon look at the spine and they say, it's nothing wrong with it. I don't know why you are having the pain. Some of them become narcotic addicts. Some of them, unfortunately, they get branded as pain seeker and so on.
Sure.
Because we are just looking in the wrong place. And the patient come to me and say, my pain is real. I feel it, even though my surgeon investigated everything, but they investigated just the spine. And this data, 43%, truly is tremendous understanding. This people get the same pain back that they had before the spine fusion. But it's easy to understand that. They say lower lumbar spine and the sacroiliac joint are just 1 inch apart.
Right.
Symptoms can be so similar and so confusing. Remember the chameleon joint.
Right.
That we think patient come back and says, I have the same pain I had before you did my surgery. And the surgeon looks at the fusion, it's good. Look at the hardware, it's good. Look at the rest of the spine, it's good. And he has to say, I don't know what's going on. It is you. I don't see any problem, just because they're not trained to diagnose, investigate the sacroiliac joint. And lots of people are practically stay behind the development that now we understand what the sacroiliac joint is.
Am I correct in assuming that after those people who have had back fusion surgery, that puts more stress on the SI then?
Many times it does. Many times it does. I'm not sure if you want me to share a picture with you on my screen or not, but I will send you the full pictures about
yes,
that.
Send me the pictures. We'll put them in.
Well, we will.
That really helps.
What the picture would show is that how close really L5-S1 and the sacroiliac joint is. And when you take the motion away from L4-5-5-S1, the lower lumbar spine, when patient moves, that motion goes somewhere.
Right, exactly.
That is either the level above or level below. It just happened to be the level below is actually sacroiliac joint. And you ask me, what are the typical sign or history of the sacroiliac joint? We talked about the woman after they give birth. for that reason, women are more likely than men. One of
Sure.
the hallmark of this joint problem is that it's more prevalence, more happening in women than men. Beside the fact that it's after pregnancy, it's more often.
Sure.
One of the hallmark of this is that it is more in younger women than older women. Like problem of the spine are more likely in people between 45 and 70. Problem of the sacroiliac joint, those on average, those patients are 10, 15 years younger. It's younger people who work out, people who go
Sure.
for jogging and so on. And another
Runners, basically.
runners, especially the runners, any kind of impact. And another sign, another history that we hear a lot with people with a sacroiliac joint problem is that they may have any other trauma in the last 2 or 3 years before it really starts. And so you see that sometimes the effect can come months or even years later after a trauma of any kind, like they fall, they have a car accident. And we understand now more because it is such a tremendously strong joint. Sometimes it takes a little more time for the joint to start causing this kind of symptoms.
Could it also be caused by as something as simple as being in the habit of sitting on one side all the time? Like if you sat, I mean, would that be enough, or would that not be able to?
That's a very good question. And the answer to that goes 2 ways. Yes, see, there is a reason Lord or nature gave us 2 sacroiliac joints, because it wants to share our weight on 2 sides. Now,
Gotcha.
Imagine if you have a problem with one of your legs and you're standing all day long on the healthy legs, at the end of the day, the healthy leg is going to complain.
Sure.
Because
And
you have been overusing it.
or if you have a shorter leg.
For example,
Right.
absolutely. As a matter of fact, believe it or not, I myself had an accident as a child. My left leg is shorter and is actually much weaker.
Gotcha.
Guess where most of the days my pain in my legs is on my right side,
Right.
on my healthy side, because I'm overusing it. Now, one of the hallmark of the sacroiliac joint is not only people who use one side more are more prone to have it because the joint is not designed to take our entire weight, but as well, people who have sacroiliac joint, you see them, they go side to side. You see them whole month or whole week leaning to one side, and then you see them a month later, they're leaning on the other side. They explain that the pain is sometimes on one side, sometimes on the other side, and so on. But that, when you understand the pathomechanism of this joint, it makes sense. It is a joint that it's supposed to take half of our weight, and if one side is diseased and causing pain, you're overstressing the other side. And by the way, the first side has some time to heal, that pain gets better, and it goes back and forth until we start fixing it for good.
One thing I want to point out, and I thought you mentioned this in your presentation before, that it really, it's 1 in 4 people that come to see you. I mean, if you figure the next 4 people or 8 people that come in, it's going to be 2 of them possibly could have SI. So it's a really high percentage.
That is amazing, actually. And it is even more amazing than that is that how many people, before I learned this, I used to send out and telling them I cannot help them.
Right.
I think the most amazing part of that is how many people don't get adequate care because and historically, there is a reason we are we have so neglected the sacroiliac joint. The only way we knew how to fix that joint used to be going from traditional open surgery from inside out and cutting all those muscles, all those ligaments to get in. But for almost 70 years, the solution, the surgery for sacroiliac joint was worse than the disease. So we quit doing anything, doing any research, understanding how the joint works and so on. So we are 70 years, but for the last 20 years, literally my community has woken up, start understanding this, but unfortunately it hasn't penetrated now yet to our entire community of spine surgeon, how to diagnose it, how to understand it, how to treat it properly. So for that reason, still many patients are sent out of spine practice locations being told there's nothing wrong with them and they have to live with the pain unjustly.
Okay, again, we'll have his website down below in the comments, as well as to the links for the previous presentations on the lumbar spine. So thanks again, Dr. Abbasi.
Always my pleasure.
Yep. Take care.
Thank you. Bye-bye.